In my clinic, 99% of patients choose a feeding tube. Not all of them start out that way. So one of the things for me as the role of the nurse is to educate the patient on exactly what it is and what it is used for. So I think in general terms, patients associate a feeding tube with extending life. And in an ALS patient, I always say that this is not the case. It's not going to stop your ALS from progressing, but it is a support measure to help you deal with something that may be very hard for you at this point in time. So lots of patients struggle with choking on food, having a hard time swallowing, and when they get a feeding tube, not only does it eliminate all of that and they don't have to struggle with meal times and taking a very long time to eat, but they actually end up with more energy because they're getting the nutrition requirements that they actually need. So I let a patient see what a feeding tube looks like, hold it, touch it, ask questions about that, give them the instruction as far as it's really not that big of a deal when you're talking about a surgery. A general overnight stay, maybe, sometimes it's in and out, and that a nurse will follow up in the home to make sure that they understand the training and how to use that tube. And then if there are any complications along the way, to call us and ask those kinds of questions. Sometimes it's just a very simple tweak in the way that they're administering the feeding that can change everything. So it's just eliminating all of those questions. In our clinic, we also go so far as to recommending that the patient will see the gastroenterologist, the doctor that actually puts the tube in. He can also answer any kind of question that they have, and let them see the tube as well, and also go through a training session of this is what it looks like, this is how a feeding is done, before they ever make the decision to go with it. I always want the patients to be educated and know all that there is to know about it before they decide whether a feeding tube is right for them. And then I always tell the patients that we will follow whatever their desire is. If they choose not to get one, that is their wish and we will honor that. But I want them to be educated in that decision before they choose not to have one just because of fear of not knowing what it is.